We want to tell you about a brand new program that's getting started at Queens. It has to do with acupuncture and cancer patients. And with us this morning is Jane Tsuchiyama, acupuncturist, and we want to find out. I hesitate to use the word experimental because acupuncture has been around for hundreds of thousands of years.
Over 3,000 years.
And so from that standpoint, it's not. But to work with cancer patients is sort of a groundbreaking in a way.
Yeah.
Tell me about the background of this, why it's considered to be a good idea.
Well, first of all, I want to thank you for having me here today, and I'm really excited to be launching the acupuncture program at Queens Cancer Center. It's a world-class center, as you know, and we're really pleased to be able to bring this treatment to cancer patients here in the state of Hawaii. Cancer patients go through so much, whether it's chemotherapy, radiation, surgery. It drains them both physically and emotionally. And a lot of these treatments can generate side effects like nausea, vomiting, pain, headaches, insomnia, digestive issues. There's a whole litany of physical issues.
That's quite a list. And,
yes.
And acupuncture can relieve some of those side effects?
Absolutely. Actually, there are a number of studies showing how effective it is to help relieve some of these side effects. And those are just the physical aspects of receiving cancer care treatment. There's also the emotional side effects. That's depression, anxiety, and stress. And Kirk, as you know, I'm sure you know some people who may have experienced this, and it is a really stressful disease. And acupuncture can help not only to alleviate some of these side effects, but boost the immune system as well as help overall with coping with the stress and depression of this.
This is a real good example of holistic approach, that is to incorporate the best of both worlds when it comes to medicine, modern medicine with the chemotherapy and so forth, with a traditional, more Eastern, I guess, for lack of a better word, approach. Do you have to be a cancer patient to receive acupuncture treatment at Queens?
No, actually, you're a cancer patient. Any cancer patient and any patient who is a cancer survivor is welcome to receive treatment at Queens. And we welcome you to call 547-8777. Actually, it's 545-8777 to schedule an appointment for acupuncture.
All right, we'll keep that number handy for folks in case they want to find out more about it. I want to find out more about it. Can you stick around a little bit?
Absolutely.
And maybe I'll get an acupuncture treatment myself.
Oh, I'd love that.
All right. Thanks very much
Thank
for
you.
being here, Jane. Aloha, Betty. Thanks very much. We want to spend another few minutes now with our specialist this morning, Jane Tsuchiyama, who is an acupuncturist and has started a new program at Queens dealing with cancer patients and side effects that they might have from treatments that they're getting. And acupuncture is used to relieve some of those side effects. What other types of maladies can be treated with acupuncture?
Well, in addition to the side effects that we spoke about earlier, the World Health Organization has recognized almost 50 different conditions for which acupuncture through clinical trials can be used for, effectively used for. Things like asthma, allergies, stroke, neurological issues, fertility issues. And as a matter of fact, when I was a research acupuncturist at a hospital in New York, Lutheran Medical in Brooklyn, we studied the effects of acupuncture during labor. And there we were able to actually provide acupuncture to mothers while they were giving birth. And I'm proud to say that we had a 22% reduction in C-sections on those study patients. So it was a phenomenal thing. That's what's really wonderful about bringing acupuncture into the hospital environment, because it's there for the patient. The patient at Queens can now schedule their acupuncture around their chemotherapy or radiation treatment, which is really the best time to schedule it. That's when the most side effects will occur, 24 hours before, 24 hours after their treatments. And it's there all under one roof. They don't have to travel anywhere.
Does it hurt? Is it safe?
Yeah, well, Kirk. I don't know if you know many children who like needles. And, you know, when I treat children in my practice, most every single one of them has needle phobia. And as a matter of fact, you know, when they experience their first needle, they suddenly look at it and they say, "Oh, wow, cool," and they just can't believe that they don't feel it. And Kirk, I know that you had a flu shot a while ago on air, and that needle was probably about 50 times thicker than the needles we use.
Really?
Yes, and I can show you one here.
All right.
This is the needle. They're all FDA approved, they're sterile, and they're individually wrapped. When we use them on a patient, we use them once and we throw them out and we put them in a sharps container. So acupuncture is very safe. I can actually honestly say that there are minimal adverse effects to acupuncture, if any.
You were telling me before we came on the air you studied for 4 years?
Yes, I have. I studied at Pacific College of Oriental Medicine in New York for 4 years and did my internship at New York Hospital at the Hospital for Joint Diseases.
I'm offering up my hand.
Okay, terrific, terrific.
For all those
and
people
everybody should know that a licensed acupuncture will always have clean hands, and there's always a clean field. We always prepare the site before the needle insertion. And I'm just going to use a point on Kirk today that is commonly used for things like headaches and pain. And I'm just going to let that alcohol dry a little bit so it doesn't sting. And I'd like for you to relax. So we'll put that like that. And that's it.
That's it?
That's it.
Well, that didn't hurt at all.
Anything? Yeah. And you know, then again,
almost disappointed, huh?
well, I know other people in the studio, and we generally manipulate it a little bit, and we like to experience a sensation that is in Eastern medicine is called chi sensation. But just for today, just for the experience, I just wanted you to see how thin the needle is and how gentle it is. And for cancer patients, we use thin gauge needles just because they've gone through so much that we don't want to overtax their system and just really support them. So, and the needle gets removed. In a regular treatment, you might have 5 to 10 needles in your distal points in your body,
and it would go for a longer period of time, obviously.
Right, for sometimes 15 minutes, depending upon the patient, or sometimes as long as 40 minutes.
Okay.
There's also auricular acupuncture, which can be used for things like smoking cessation, which is one of the programs that we're trying to develop at Queens as well.
We just scratched the surface, to coin a phrase, but we appreciate all the information, and great to see all kinds of medicine being incorporated to help the patients. Thank you very much, Jane, for being with us today.
Thank you for having me.
Appreciate it.